us some education on this is Betty Owusu-Ansah. She's a principal nursing officer. So let's get educated. All we need to know about hypertension. So, Betty, welcome. How are you? You look lovely. Love the black and white.
You look good too.
Thank you. Let's get right into it.
Okay.
The little clip on Galamsey, did it raise your BP a little?
In fact, I got scared.
Yeah? What did you think it was when you saw those bottles?
Probably Milo, Lipton. That was on my mind.
That's what you thought, eh?
Yeah, I thought it was some beverages.
This is actually water from the plant. And our guys sampled it themselves.
It's serious.
So from your perspective, being in the health sector, what are your general views when it comes to like Galamsey, you know?
It's life-threatening. Apart from the effects of Galamsey, it also has a whole health implication or effects on the people involved in it, because a lot of it causes pollution in a hole, and it's very dangerous. I remember working in the at the accident center. There were several victims who were involved in the collapse of the
some of the pits.
Yeah, the pit that they were, and some end up dying because it was a total spinal injury, and they didn't have money for the operation too. So it's deadly. I wouldn't advise any person, individual, or even my enemy to involve themselves in.
Well, we've taken up the course, and so yes, indeed, a course to stop Galamsey across the whole of Ghana. Let's talk about hypertension.
Okay.
First, let's define it. Okay. What's hypertension?
Okay, high blood pressure or hypertension, basically, in a layman's term, is when the pressure in the blood vessels are high.
Okay.
That is, the blood vessel is just like, symbolically, it's just like a gutter. Okay. And the blood in it is just like the water running through the gutter. So when the blood vessel is blocked with fatty adipose or fatty tissues, or adipose tissues, just like the gutters are being blocked by rubbish, it impedes the flow of the water. So when it happens in the blood vessels too, it impedes the flow of the blood. So where volume increases, pressure increases. So basically, when the blood is not moving freely through the blood vessels, the volume increases and the blood pressure also increases. So when we check the individual's BP, this is the physiology aspect. But when we check the individual's blood pressure with the BP machine, it records 140/90 upwards. When this is done on more than 3 consecutive times, we can conclude that that individual's BP is high.
Okay. And when do we say someone has low blood pressure?
We say someone has low blood pressure. Let me just make this clear to viewers. Some people naturally have a low blood pressure. So far as it doesn't interfere with their activities, they are good to go. But when we say someone has low blood pressure, it means that person's reading is below 90/60 millimeters of mercury. Yeah.
Okay, so walk us through. For what exactly is happening in your body when your BP goes high?
When your BP goes high, research shows that it's difficult for one to know that the BP is high. It hardly gives a symptom, so mostly we consider it as the silent killer. But what happens is that if you use the automated machine or the manual BP machine to check the BP, you will get the reading and you know that it's high. That's the easiest way to know that your BP is high. Notwithstanding, other people exhibit some symptoms like headache, fatigue, dizziness, nausea, difficulty in breathing, palpitation, and others also experience numbness. So
numbness in which part of the body?
Any part of the body that there is poor flow of blood. Yeah. Mostly the extremities. They sit on the WC, getting up, they feel numb, and locally they will say anansi achime.
So that's a symptom that you might have high blood pressure.
Others also experience hiccups.
How about if you hear a ringing sound? If you hear a ringing sound,
the tinnitus, like ringing, buzzing in the ear.
Yes.
Some people also experience that.
Okay, so when that happens, does it mean your BP is high or low?
It can be so many factors because there are so many conditions that people also experience the ringings, the buzzing in the ear. But when it comes to hypertension, not all the signs and symptoms that an individual will experience.
Okay.
Some of them.
Okay. So what is the normal blood pressure?
The normal blood pressure is 120/80 millimeters of mercury. And as I stated earlier on, some people naturally have a low blood pressure. That is why there is a need for you to know your baseline reading. So we advise that every individual should at least check their BP so that they will know their status.
Okay, so what are the common symptoms running across, whether high or low? What are the common ones?
Okay, so the issue is that low blood pressure is not so dangerous as compared to high blood pressure. Okay. And with the low blood pressure, it's easy to get some signs and symptoms at least. And most people go into low blood pressure when they have, they've lost fluid, be it blood or water, through vomiting, through diarrhea, or through bleeding. Or some people, sudden exposure to heat causing dehydration can lead to low blood pressure. And one of the most commonest symptom or sign is that they experience dizziness, weakness, and sometimes difficulty in breathing.
This is for people who have
low blood pressure. But with the high blood pressure, as I already stated, it's difficult for you to get some signs or symptoms, except we check with the BP machine for us to know that it's high. Okay. But the other symptoms are some individuals who experience that.
Right. How about nose bleeding?
Nose bleeding is also part of high blood pressure.
Okay. So what are the lifestyle choices? What causes our BP to go either high or low?
Okay, for one to have high blood pressure, age is a common factor. As you age, your BP increases. So if you are 14 years and you are 160, as you get to 25, 35, it will automatically go up. That is nature. We can't cheat it. Another contributing factor is family history. Assuming your great-grandfather or any member of your family is or was hypertensive, and you do not take good care of yourself, you can also have high blood pressure. Not to say that everybody in the family will get, but if you do not take good care of yourself. Another contributing factor is high intake of salt diets. Okay. Some people will say, oh, we do not take a lot of salt, but the person is taking spices that contain salt, like MSGs. It can also contribute to high blood pressure. Another contributing factor is pregnancy.
Right.
Some people get pregnant and their BP goes up. Another contributing factor, lack of exercise. Right. Overweight. Excessive intake of alcohol. Sedentary lifestyle. The individual moves from the house, sits in a car, drives to the workplace, hardly exercises. The individual can get high blood pressure. Another contributing factor is high intake of fatty diets. Right. Yeah, and some disease conditions like diabetes, if left untreated, it can also lead to high blood pressure. Okay. Smoking,
Right. So for people who have low BP, does it mean that when they get older, their BP keeps going low? What happens to them?
If you have a low BP and you exhibit these signs and symptoms, it's very important for you to go to the nearest health facility so that at least if it's a fluid loss, we will replace it through intravenous fluid. If it's because of anemia, then we will give you blood transfusion depending on the level. Okay. If it's not too low, they can start with hematinics to build up the person's HB.
Okay, and so now you've been diagnosed that you have high blood pressure. Is it a lifelong disease? Can you cure it, or you just have to manage it?
Research shows that hypertension is 100% preventable. Okay. And it's manageable. Okay. But the curing is you can't cure it because of the contributing factors that brings about the condition. So you will hear a lot of people saying that I can cure you from high blood pressure, but if you should go back to do a research and take hold of that cohort, the number of people who were supposed to take the medication and the prescriber, or let me say the herbalist, told the individual that I've cured you, you realize that they are living with hypertension complications. Because here is the case, the person is still overweight, the person is still consuming high salt products, the person is aging, the person is having a sedentary lifestyle. So if you tell me that you've cured it, it can be for a period. But if you don't take care and you accept that it has been cured, you may be living with the complications at the end. Not to say that you can still have a normal BP if you stay away from all these contributing factors that I've talked about.
Okay. Now let's talk treatment. First, the foods are there certain foods that we should avoid totally, apart from the fatty foods?
When I say avoid, it will be difficult for the individual. So we always use the reduction method.
Okay.
When I tell you that don't take alcohol, the person will end up abusing it. So I will tell you that reduce the amount that you consume. Reduce your salt intake. When it comes to smoking, you stop it. When it comes to lack of exercise, you engage in exercise by starting from the lower level to the higher level so that at least you can burn some fat. When it comes to the diet, you should take more whole grains. We use the DASH in management of hypertension. You take whole grains, you take less fatty diets and low salt diets. You also need to rest because stress is a contributing factor when it comes to hypertension. You need to have enough rest and also free your mind from any unhealthy or negative things that takes your mind or makes you think a lot. Yeah.
Okay. How about garlic? Does eating garlic a lot or regularly help in managing your blood pressure?
Not just eating garlic helps in managing. Any food or any product or any thing that we take in that contains potassium helps in reduction of the BP, because the only thing that hypertension is scared is potassium.
That's it.
So garlic is a food, or let me say a spice, that contains potassium. It has a chemical called allicin, and that allicin gives its pungent smell and also has the effect of making the blood lighter. So it aids in the free flow of blood in the blood vessel. So when we take garlic, some people take garlic because it contains potassium and it helps in making the blood lighter. That's the reason why when doctors are even prescribing drugs that makes the blood lighter, they ask, do you take in garlic? Because it makes the blood lighter and it can cause bleed. Okay,
how about coffee?
Coffee.
What does
Research shows that too much coffee can increase an individual's blood pressure. So if you are taking too much coffee, you reduce the intake.
Okay. And so in this case, so if you have low BP, is it good to take in coffee?
No, I wouldn't advise that, because it's very difficult to go into high blood pressure for you to come down. So if you are having a low BP, the best thing is you have to go to the healthcare facility or any nearest facility, healthcare delivery facility, for them to know the cause of the low blood pressure. Probably it might be the origination of another condition. So it's not advisable to manage it all.
So are there any natural remedies to control your BP when it goes high?
There are natural remedies, a lot. Exercising.
Top on that thing.
Exercising. And apart from that, the food that you take, you can just look at the contributing factors of hypertension and realize that most of them we have control over, like high intake salt diets, like high intake of fatty diets, lack of exercising, like stress. So we have control over those things. And also when you are pregnant, it means you have to be checking your blood pressure and you need to rest. Check the food that you take in. So we have control over, and I consider these as natural remedies. Apart from that, there are foods that contains potassium, and it also helps regulate one's blood pressure. I'm not saying you should put your medications down and consume these things. No, you can be doing them alongside and also consult your doctor if it's best for you. So you can be taking something like coconuts,
right?
Coconut water, the fruits, even the cover of it. You can just, anything about coconut is healthy because it contains a lot of potassium. Apart from that, beetroots, apple. You can take apple, you can take beetroot, carrots. They all contain potassium. Dandelion,
right?
Very good. You can use it for salad, and it helps in controlling your BP. I'm still repeating, don't put your medications down and take these things as a remedy to cure hypertension.
Right. Betty, do we have a lot of young people coming in with hypertension and BP-related problems, maybe young adults?
Yes, a lot.
A lot?
A lot. So we've been screening Ghanaians for the past almost 10 years now on high blood pressure in the month of May. We call it May Measurement Month, which was initiated by the International Society of Hypertension. And for the past 7 years since we started, we've realized that the data that we collected from Ghana, most of them are young adults.
Right.
And the sad thing about it is that total number of people that we've screened, about half of them were hypertensive. And they are not, half of that number do not know or did not know or were not aware that they were hypertensive. And those who were hypertensive were not adhering to their medication religiously. So there is a need for us to make more noise about high blood pressure because it's now rising among the young adults because of our sedentary lifestyle, our activities. The individual is working, having a family, schooling, and other things. And also the intake of alcohol, the intake of these drugs just to enhance their sexual activity.
Enhancing drugs.
Yeah. And lifestyle, basically lifestyle. So you will see, I think our first screening that we had, because of confidentiality, I will not just mention where we had the screening. We screened a young guy who was 16 years old and his BP was more than 150.
16 and his BP?
16, yes.
More than 150.
When we interrogated him and talked to the brother confirmed that he prepares egg, puts salt in it, and adds another spice which contains MSG. And he is the type taking that combination each day. So you see, what we take in make us. So be mindful of what you eat. Always when you're eating something, think about the health benefits to your life so that at least we will all be healthy because we need you alive.
Okay, so what's the prevalence rate? I mean, the ratio between men and women in Ghana. Can you speak to the facts, the numbers?
So when we take the prevalence rate of hypertension in Ghana, it's between 30 to 40%. And when we take the ratio between men and women, the problem is because most men do not report to the facility when they are sick. So it's noted in Ghana that the women have high prevalence rates before menopause. But the sad thing is that most men die from high blood pressure complications.
Because they don't go to... why? Do they have a reason why they don't go to hospitals?
From all indications, society. One, society see a man who goes to the facility or the hospital as a weak man. It's because of how we've put men. We see a man who complains of sickness as weak. Why are you a woman to say you are sick? And hardly. They are so busy. They are exposed to so many contributing factors that brings about high blood pressure. Most of them don't care about what they eat. Hardly will a man buy a fruit, but they will buy it for a lady, but for themselves, they will never do it. So it depends on, it's more of their lifestyle and how society perceives them to be.
Society is shaming them into not going into the hospitals to get checked. Right, Betty, if unchecked or if untreated, what happens to persons who have hypertension, high BP?
So the condition hypertension is not so dangerous than the complication. So when high blood pressure is unchecked, it leads to blindness.
Blindness?
Yes, it leads to blindness. It can lead to heart attack. It can lead to stroke. It can even lead to kidney failure. And it can lead to impotency in men.
Wow.
Yeah.
Wow. Okay, so how often should we go get checked? How often should we check our BP?
I will advise that if you fall within the contributing factors that I'm talking about, you should get yourself a BP machine in your home. It's very, very easy for you to get one. If you can buy an Android phone, you can buy a BP machine. And it's easy for you to check it yourself. You just need to be trained.
Can we go through it?
Okay.
So guys, if you get a BP checker, this is how you do it.
So we have the manual and the automated one. This is the automated one. And usually, you let the individual sit down and relax for at least 10 to 15 minutes. You make sure that the person has not taken in cafe or any caffeine products or energy drinks. Then you let the person relax in the chair. Mostly, we make sure that we check it when the person's arm is exposed. So just as I've done it, you can either use the left or right arm, depending on the position of the person. So when you are checking, you make sure that the cuff size, it will be comfortable on the individual. So look at your arm and the cuff is okay. It shouldn't be too tight and it shouldn't be too loose. Other than that, you get error readings. You make sure that this rubber tubing is in line with the middle finger. You get it? Okay. And this should be just above the elbow. So, are you comfortable?
Yes, I am.
So, assuming she is relaxed with her legs on the ground, then you press on the start button. When you press on the start button, the cuff will inflate. You will feel some pressure. If you make it tight, she will feel uncomfortable and it can affect the reading. So when it inflates, automatically it will deflate. When it deflates, the systolic number, which is the top one, will come. That's the reading. And the diastolic is the middle one. And the pulse, that's the heart rate, will also appear on the machine.
Right.
Then you know whether you are hypertensive or not hypertensive. But we will advise that the first reading shouldn't scare you because that may not be your actual reading. You can check it the second or third time.
Okay, then you stay here with me. We've been having a conversation on hypertension, and we've been doing this with Betty Owusu.